the eruption of the teeth and the direction of their movement with growth will compensate for minor variability of the facial structure. In other words, it will make up for the variability that's within the facial structure. That's compensation, making up for something else. So he and Bjork talked about compensation. So this is a very common term in orthodontics. The compensation that is made by the teeth when the jaws are not always straight over one another. So the last principle was then that whenever nature could not make the compensation, it was the job of the orthodontist to come in and make that compensation possible by moving the teeth. So we come back to what I had been saying for many years, and I suppose this is the reason why I found Solo's work so exciting. These are principles, fundamental truths that we can be guided by and follow as a rule. The big rub comes in what they're going to be when the patient is matured. And secondly, then, what we might do to alter that.
Alter what?
Alter that relationship with the jaws. In other words, what is the target? What is the goal ultimately going to be? So, all of this first hour, I have tried to get across the idea that the teeth have to be related with respect to both jaws. Now, in effect, then, what has he really said? He didn't say it in so many words. But what he was showing was that Sella was not a good point to use in the diagnosis of the relationship of the jaws. And yet, literally every diagnosis there is, and the American Board of Orthodontics and all, ask for a Steiner analysis, which is based on Sella. Let's look here. This may be a little bit out of place, a little bit out of order, but I'll be touching a lot of this with you anyway. Here are two patients. All right? Now, what do you see in this patient? The angle Sella, Nasion, Pogonion is 81 degrees. That means that the chin is forward. And here's the patient. Now what does this 75 tell you? If I just look at the number 75 degrees, it would tell me that the chin was backward. Now which one of these cases has the deepest face? I'm going to superimpose here on Frank's. Which one of them has the chin that's forward the most? Well, that one, but yet it's 75. Now, this patient doesn't have room for the second molar. Plenty of room for the second molar. So this is a short ramus, a short body to the mandible. Much shorter here in the black, but yet it's 81. So SNB is entirely misrelated here. I'm going to superimpose on Bayesian Nasion. Now, which one tells us what the patient really is? The difference is the height of Sella. It just got me in too much trouble too many times. Now, if we look at the study of Sella on a longitudinal basis, it is in the neural cavity. It is related to the growth of the brain and the development of the neural structures. The face is the splanchno-cranium. Now all this simply to start the discussion of biology. Because let me say again, the problem in dealing with a child, when you come down to it, is really the anticipation of what that relationship is going to be by maturity. And if you accept that, then there is no way other than to do a forecast of the developing child. Many orthodontists will simply let the child alone. They won't even try. and wait until all the teeth are present and then go in and treat the teeth. So what is another principle in bioprogressive? Making a forecast, treating early, doing orthopedics. And now you realize what a job I've had all through my career in trying to get that idea over to people. So biology. Starts really with environment and genetics. What is the etiology of malocclusion? A mother sits there in your office. Yes, doctor, I know, but what caused this? Why is my little kid so ugly? I had a mother one time. This little kid was sitting there. And the mother said, "Is there anything you can do with him? He's the ugliest thing I've ever seen." It was her son. What's your impression as what causes malocclusions? On the basis of genetics, how much? And on the basis of environment, how much? Do malocclusions get produced? If genetics is there, how much is it there? Just as a concept, just as an idea. As a hypothesis, a broad speculation. Is it 50-50?
例えば遺伝的原因が 50%、環境 50%、ざっとでいいんです。先生どう思われます？半々。
70%.
Genetics?
70% what? Genetic. I think it depends a lot upon the type of malocclusion you have. So there's no question about mandibular prognathism being genetic. If that is true, then the antithesis also has to be. And when enough of these components combine together, you've got dysplasia that is beyond the normal compensation of natural development. But on the other hand, you've got breathing problems, you've got thumb habits. And when they're dramatic and continuous and long term, they can have an overriding effect. Okay, let's talk about genetics just a little bit. Dr. Jones last night talked about prepotency. The word prepotency means that the male or the female may be dominant in the offspring. Dominant. In other words, one parent may have the children look more like them than they look like the other parent. So if I was a stud horse and I was the winner of races and I had proven prepotency, I would be a lot more valuable as a sire for those offspring than someone who did not have that prepotency. I have a set of triplets in the practice. Identical triplets. Very rare. Now here's the interesting thing about them. In fact is, the way I got them was that one of them was married to one of the girls that worked for me who was a twin. So she was a twin and she married triplets. A very fascinating thing because it's almost as if it's all the same family, you know. It was a very close relationship between the brothers and the brothers' wives. It's almost as if it was the same family. The first two brothers had essentially normal occlusions, except one tooth. They both had a crossbite in the upper right second molar. Now, the third brother also had a crossbite in the upper second molar. Right side only. So three triplets all had crossbites, and that was the only crossbite that was present. Now, the third brother was also class 2, and so I treated him, but I didn't treat the first two. They just said, we don't want to mess with it. Down to the crossbite of one tooth, genetically. Now, that's crazy.
で、その本当にたった一本の
genetics would go down to the relationship and the development of one tooth. My brother and I, we
私もそう
were
なんですね。
18 months apart.
兄弟です18ヶ月違い、1歳半違
On
い
the
で兄弟
lower
がい
right
ますけれ
side,
ども。
both had a lower lateral that was lingual to the canine. We both had a lower lateral on the other side that was labia.
そうなんです。もう反対側は伸側になっていて。
We both had exactly the same arch form.
私たち兄弟もアーチの形態全く同じ。
Sequence of development.
ありますけど。
Lawrence was an animal studier in Germany, and he proved that even our muscle patterns are passed on. He inherited the muscle pattern.
つまりそのマッスルパターンそのもの、あるいはその筋肉。
And I make a strong differentiation, or I try to, particularly in the event of tongue problems, because I'm convinced that tongue thrust can be inherited. Deglutition patterns,
嚥下のパターン、
motor patterns
それから動きの運動のパターン、筋肉の動きのパターン。
can be passed on to offspring.
これ
So there's a big difference in the treatment, in the success of treatment and the prognosis.
で
When a mother comes in and says, I had orthodontics when I was a child growing up, and she's got a relapsed open bite, and here I'm looking at one. What am I going to say?
ですから、
So we can inherit the color of our hair,
例えば髪の毛の色なんていうのも
Eyes
それから目の色とか皮膚の色と
our
か
height,
身長も多分親譲りでしょうし、
our motor patterns,
それから動きのパターンも
our
親譲りだろう
endocrine
し、
patterns,
それから
And if it goes this
パターンも
far,
そうですよね。
even the way we think.
それか
Genetics is very, very powerful.
ら、
So we begin to look, and maybe 70% isn't too bad. Now, what is the danger of accepting genetics as the final cause or the causa finalis? What is the danger of that?
ですか
And this is where I had trouble with my old mentor, Dr. Burton. So it was not that I was taking exception to his personality or to his character.
まあ
Professionally, I had to disagree.
まあ私
What is the danger of putting genetics up,
ですからもう遺
higher?
伝的な
The doctrine of limitation. That if it's genetic, you say, well, it's hopeless.
つまりその
The more you can accept the fact that they can be produced as a result of function, the more capacity you have to successfully treat. I would like to think in my thinking that maybe it's less than 70%. So maybe I would put it a little bit in the range of 60-40 as a concept.
60% ぐらいはどうでしょうか。
With the ability of physical means, function, and so forth, having more of an input, maybe in overriding some of the genetic characteristics.
その
I started today with the idea of reinforcement of an attitude of biology. Most dentists, by their discipline, are mechanics.
で
Teeth are hard structures, and we tend then to think in terms of something that is hard and rigid. Then we use a mechanical articulator to mount the teeth, and something rigid and fixed.
そう
And it's hard to shift the thinking from the balls of that articulator to the soft tissues that are living. We hear people talking about fixed patterns of movement in the jaws without really thinking about what is propelling the jaws naturally.
そういう
It's powered by muscle and directed by nerves. And between the teeth and the muscle is bone,
で
which is
愛します
connecting the whole thing together. And therefore it's called connective tissue.
で
And so we're going to be starting talking about connective tissues. So we got into the idea of bioprogression or biologic progression. But what it means is a group of principles integrated into a philosophy. Now, to exemplify that, we started talking about the cranial base
でその
and some of the work that was done by Simon years ago in terms of the so-called clinical norm.
で、
And from there we went into the solo principles and finally then to some of the principles here of biology.
でそ
Yeah. Let me see if I can come back with this environmental thing.
もう一回この環境の影響というのを考えたいと思うんですけど、概念的にですけど、
Conceptually, the major aspect is genetics.
まずそのメインなところにこの遺伝
I
的
think we all concede that. And let's just say this is 70%.
でこれが 70% だとします。
All right, now we have environment over here.
で今度は環境、
And let's say this is 30%.
これが 30% だとします。
Only as a concept, only as a wild
こ
speculation.
れはあくまでも概念上の話です。単なる憶測で
What
さえ
makes up the different aspects of environment? If we're going to talk about environment, what makes up environment?
これから環境の話してきますけども、環境を構成するのは何でしょうか。いろいろあります。まず
First thing is the physical forces, the pressures,
物理的な力、
the actions,
圧
the
力、
function.
いろいろな力がか
So
かる機
physical
能、
function,
物理的な機能が一つある。
a tongue habit, a thumb, anything that is going to be effective in altering an environment of the teeth. So we're going to try to relate this to orthodontics as much as possible. Now, in all aspects of the environment, there is a time element. We know that if, for instance, I was born and raised on a farm,
例えば私は農場育ちなんですけども、
and we used to have little pigs.
で小豚がいました。
We raised pigs, hogs.
養豚してたので、
And we would have a rut develop, have an animal that didn't reach his potential with the rest of the group.
でどうして
I don't know whether you know it, but when a sow gives birth to a group of pigs, each one of them has one of the udders that is theirs.
でご存知かどうか知りませんけども、その母親の豚がいて、
And it's
乳
usually
首がたくさんあって、
it's usually the strongest gets the best tip. Now let's supposing that she has 12 udders.
で例えば乳首が12あったとします。
She has 12 pigs.
と12頭の子が
If she has 13, somebody's going to be left out.
ならいいんですけども、13匹いたらば、
So that
13
pig's
匹
going to
は
die.
死んでしまいます。
But the ones that are near her back legs,
で特に後ろ足に近い
down on the chain, that little pig can't get in there very well.
なかなかこう入っていけません。
And so he's not going to be able to nurse when the other pigs do sometimes. And that little pig would become a runt. See, he would not grow with the other pigs.
で他の子豚と一緒に成長ができなくなる。
Now, we would take that pig then away
でこの最後に残された子豚を離してしまう。
and feed him.
で人工的に与えます。
And he would then catch up with the other pigs.
そうすると成長が追いつきます。
And indeed, sometime go beyond.
場合によるとそれ以上他の子豚たちよりも大きくなる。
In other words, it's like a time clock, a biologic time clock,
これ
Unless-
生態時計みたいなものです。
unless it lasted too long. If the feeding and he became too much of a runt, then no matter what we did, he wouldn't be brought back to the size of the other
それが
pigs.
仕送りになります
So there was a time there.
だからある
So
程度その時間的
when
な
we
こ
talk
とが
about
決まってるんです
environment
よね
now, there is this element that we have to look at, and it's a little more complicated than what we think in the beginning. So here's nutrition,
時間の
is the second environmental factor.
栄養というのは第2つ目の環境因子です。
And any time that you have a little bit of a damage over a short period, there will be a rebound. Physiologically, the subject or the animal will rebound. The human will too.
で必ず何か
But if this
何か
becomes prolonged, the physical effects then are going to have a permanent, they're going to have a permanent imprint. in that biologic organism. Now the next one is stress. Psychologic stress or a psychologic state.
心理的な
It's been shown in a study, for instance, that children in orphanages, without receiving the attention, the love, the nurturing that the child needs,
で
these children physically did not reach their maturity
こういった子
or
供た
their
ちは
potential.
そういう心理ストレスがあるんです。
Disease states. We think here now, again, that measles, mumps, whooping cough, chicken pox, all of these childhood diseases have only a limited slowdown of the process, that there is a recuperating, a rebounding.
で例えば
But chronic diseases,
しかし慢性疾患は違います。
diseases that are prolonged over years,
何年も持続するもの。
such as a respiratory obstruction,
例えば呼吸器
such as the adenoid facies.
のアデノイドの問題。
We think definitely that in certain of these cases they can lead to the long face syndrome. Now we say here it's a 30%, but in that patient it's 100%. So you might say that 30% of the time it will cause it, but when it causes it, it's 100% for that patient. I treated one boy who was the shot putter in the high school
高校生で
track team. He weighed 265 pounds and was 6'5".
体重265ポンド、身長が6フィート5。
He came in a hurry one day and sat down in my chair and leaned back.
で、2人でチェアに座ってこう横かかったらば、
And the whole back of the chair went.
チェアがひっくり返ってしまいました。怖いですよ。
Now where do you get such big people that we have today?
なんでこんなに大きくなっちゃったの？
Is it environment or genetics? The next question, if they're getting bigger, are the teeth bigger?
もう一つ
Good question, huh?
いい質問じゃないでしょうか。
If the jaws are bigger, then we should be able to treat without taking as many teeth out, right?
額がそれだけ
There's no question when you have large teeth and a small head that you better take some teeth out. So some people feel that it's a cosmic irradiation, the sunspots on the sun, the amount of irradiation that's hitting the earth up and down
どれだけ放射線がこの
may have some effect on the growth. Anyway, that was a speculation.
こういうのがね、
Genetics is a very powerful thing,
まあこういった意味では非常に
all of which makes it more complicated than it appears on the surface.
それだけ
Wouldn't it be nice to be able to tell a parent, well, this is definitely due to this?
もしこれが
But really what you have to say is, well, I'd like to know what your grandparents looked like.
ところがじゃあおじいちゃんとおばあ
And
ち
see where the prepotency was located.
ゃんで遺伝的特性というのがどこにあったのかから見極めなくてはいけません。
Okay, now somebody else had a question.
他の方もご質問あったんじゃないでしょうか。
Somebody about Moss's
Yeah.
idea.
Yeah, you spoke about the principle, solo second principle.
Yeah.
Is there any relation between the functional matrix theory of Morse?
Since we're talking about genetics and
ファンクションマトリッ
environment,
クスセオリーとは関連があるのかということです。
let me go back and talk about that just a little bit. When Brody did his work, if you remember, he began to notice an orderliness to the pattern of growth in his children from the 3rd month to the 8th year of life. He was impressed by 2 things he noticed as he superimposed the children in each year, an x-ray each year. He began to notice here that it added on from celling here in an orderly manner.
で、セラが
He developed the concept of the constancy of the growth of the head. Now where he got in trouble was trying to show that this also was constant for the lower jaw.
ここまでは良かったんですけども、ところが科学もそれではこのコンスタントに一定に発達しているだろうと思っていた
But
らば
it didn't work too well.
問題が出てきました。こういうふうにやっていこうとするとうまく合わなかったんです。
But what he did show here that was that the growth of the condyle, he felt, was upward and backward which directed the chin downward and forward. So the idea was that the condyle directed the growth of the mandible and the development of the face. Long bones grow at the cartilage of the epiphysis and the diaphysis. So growth of the condyle, being cartilaginous, was thought to be the director of the growth of the face. Now, in the 1950s, Moss began to take exception to this growth site at the condyle being a director.
頭蓋があるわけです。
All of these
頭
are
蓋
organs,
これ全部器官です。
and each one of them has a function.
でそれ
So he called this the functional matrix. Now people picked up on that,
でこれに関心を持った人がいるわけです。
and they said, well, if that's true, then why not just put a big denture in here, or put a big activator in here, and stimulate the jaws to grow. Throughout the 70s, then, we had this movement in American orthodontics.
出ていました。
They forgot that the mandible is not just for the presence of teeth. The mandible supports the organs of respiration. You can go without eating a lot longer than you can go without breathing. And the mandible is a part of the respiratory system, not just the digestive system. And so it didn't quite work out to the theory as much as people thought it might.
そういうわけ
Now that's the theory of functional adaptation, the theory of the functional matrix.
でこれ
Connective tissue itself is made of collagen. And the connective tissue system is one of the hidden elements that we commonly don't think about. I made this illustration up to indicate that we start in biology thinking about the individual cell,
まず
and that every cell is bathed in fluid. Every cell is surrounded by a fluid medium. In other words, every cell is an island within a lake or a river or something, but it's an island. Now that cell that's there has to get its nutrients, its oxygen,
酸素も必要です。
and have the proper electrolytes and acid base within that fluid.
でこの
And the fluid is actually in the connective tissue. Now please understand this and get this idea because it's something that we forget.
でこれは
There are three fluid mediums in the body. The greatest amount of fluid in our body is actually within our cells. It's about 60% of all of our fluid is within our cells. Although the connective tissue fluids are the least, they are still the key to homeostasis.
少ない
And once that's lost, you've got a disease.
でこの
The whole body becomes sick when individual cells become sick.
でこ
So the key to health, the key to growth, is normal homeostasis, which the body tries to compensate.
ね
On the one side, you have a blood vessel,
では
which comes down and gets smaller and smaller and smaller into an arteriole. Then it becomes a capillary. At that level, then, it transfers its fluid to the connective tissue fluid, or is what is called the interstitial fluid.
液と呼んでいま
You
す。
don't have a blood vessel going directly to the cell. The cell then gets its supply from the interstitial fluid. But the interstitial fluid, while bringing the food, also is the dumping grounds for the byproducts of the cell itself. So the waste products, the toxins, and all of this from a cell that's done its function. There's another system that helps then eliminate the waste, and that's the lymphatic system.
でしか
A part of the waste are collected by the blood going back through the venule. And it's all collected and cleaned up through the lymph glands.
きれいにされていきます。
The adenoid tonsils are major lymph glands.
でアデルリン
The
パ
lymph glands are usually located close to the joints.
で
You have axillary glands, you
例え
have
ば液化
glands
の
on
リ
the
ンパ
inside
腺
of the joint.
それ
You
からは
have inguinal glands. But the key, of course, is to understand biologically Now, when we put on pressure on a tooth,
します。
the first thing to be affected is the fluid around the socket.
その
We have expressed out or pushed out the interstitial fluid in the socket on the pressure side.
なります。
Most people forget this. Too much pressure with too continuous of pressure. What's going to happen?
ご存知では
If a cell is deprived of oxygen for a while, it's going to die.
そうしますともう酸欠でその細胞は死んでしまいます。
So you see the idea of lighter force. Biologically, this is where we start. So when we start talking about connective tissues, it is a key tissue. And you have to remember that collagen
コラーゲン
is the key structure, the key material that makes up ligament as a tissue.
人体というかこれは
Imagine now you're training, imagine a microscopic picture of ligamentous tissue. You know that it's kind of woven, isn't it?
こう編んだような折ったような形に見える
And
ん
the
です。
fibers,
で
for
繊維組
instance,
織
the periodontal ligament
繊維組織がありま
is
す。
a ligament.
で
Precisely the same type of tissue goes from the suture between the bones of the skull.
でこれ
Sutural
こ
ligament.
れ
There's some argument as to whether or not a ligament is glued together sort of in an incision, or whether or not the fiber goes directly from the cementum all the way to the alveolar bone. One fiber.
とその
But the best scholars now begin to think that it's one fiber that runs all the way through. Now, around every joint there's a capsular ligament, and it's lined on the inside by the synovial membrane. And when you have an accident in sports, twist the knee, you tear the ligament.
で例えばそ
Turn the
の
ankle,
運
you
動をし
tear
て
the ligament.
切れた
Baseball
とか
player, rotator cuff, tears the ligament. So the ligament is there as a checker or a restrainer against sudden motion. The periodontal ligament, when I bite down,
ということでその歯周靭帯も同じです。ぐっと強く噛みました。
is a checker or a restrainer against too much motion.
そうする
Therefore, it provides a cushion action.
ねありますからそのクッションのようなものということになります。
It has a degree of elasticity. But when put under a continuous force
ですけ
or
れ
stretch,
ども
it will elongate. Therefore, when we take an X-ray of an orthodontic case in motion, the periodontal space is
そう
widened.
する
Isn't
と
it?
こう歯周靭帯のスペースが広くなっています。
That's not a space.
でもこれはスペースとは言いません。
It looks like a space in the X-ray,
写真上ではなんかこう空撃のように見えるかもし
but
れ
it's
ないけ
filled
ど
with ligament.
本当はその中全部靭帯組織で埋まってるんです。血液で埋まっています。
And interstitial fluid.
それから間質液で埋
Keep
まっ
that
て
in
いる。
mind. It's full of interstitial fluid.